basically, the management of patients with myelodysplastic syndromes is largely connected to the risk stratification status of the patients. So patients who have higher risk disease generally are going to be selected for bone marrow transplantation, as long as, first of all, they agree to the risk. So going through bone marrow transplantation is, is associated with significant risks, especially for an older patient population that have multiple comorbidities. So that's, I think, one consideration. Generally, we also look at what are the other concomitant medical problems that the patient have. Is their liver, their heart, their kidney, their lungs, all of these have to be in reasonable condition to go for transplant. We also have to have donors. In the past, this used to be a big problem in MDS patients because, as we know, patients with MDS are older, in their 70s, so a lot of their siblings would be in their 60s and 70s, and they might not be the best donors. However, with advances in typing and supportive care, now we are using more and more of unrelated donors, or even half matches, what we call haploidentical transplants from the children of the patient. So I think the donor issue is becoming less problematic. However, we are still we still don't transplant most patients with MDS. There are actually data suggesting that less than 5 to 10% of MDS patients are being transplanted. We always discuss allogeneic bone marrow transplantation with patients as the only potential way to try to get cure in patients with high-risk MDS. But in reality, despite all the advances that we had with bone marrow transplantation and better identification of what we call alternative donors, aside from the traditional sibling donors, the majority of patients with high-risk MDS are not undergoing bone marrow transplantation. So I think that's largely related to the age of the patients. The median age of patients is 76. So most of them are in their 7th or 8th decade of life. Most centers, basically, in the past, we did not used to transplant patients who are in their 60s. Now we are going to early 70s to mid 70s, but I would say most big centers probably will not do an allogeneic bone marrow transplantation for someone in their late 70s. So many patients are just being excluded from the get-go. Patients who are on the younger spectrum, less than, let's say, 74, many of them are not candidates because of concomitant medical problems, diabetes, hypertension, heart problems, liver problems, lung problems. And some of the patients, many of them, because when they hear about the risks that are associated with bone marrow transplant, it's not consistent with their goals. Many of them are at a point in their life where they are more interested in therapy that maintains them outpatient and reduces the chance of being hospitalized. And of course, bone marrow transplant is not the most effective procedure as well. Only 30 to 40% of patients achieve long-term survival with bone marrow transplant. So many patients could die from complications of the transplant, or MDS relapses in more than 30 to 40%. The most common reason for failure of bone marrow transplant is relapse of the myelodysplastic syndrome. So I think because of all of these reasons, most patients with MDS will not undergo a bone marrow transplant. Registry and population and survey data suggest that less than 5 to 10% of patients with MDS currently undergo bone marrow transplant.